Hi there, it's Dr. BD, Newborn Prep Academy, and today I want to talk to you about a fever in a newborn and how to recognize and also how to treat that, okay? At the time of this recording, it's January, and so we're still in the cold and flu season, especially here in North America and the Northern America. And so it's really important when you have a newborn to know how to recognize a fever and how to treat it, because it's not out of the realm of possibility that it may pick up some virus or the other during this season, okay? So for a newborn, we are really concerned about a fever, especially in the first 30 days of life, because their immune system is still quite immature and may not be able to respond to let us know that there's something serious going on other than just the fever, okay? When you have an older baby or a child who has some significant illness going on, they may have other things happen, not just the fever, other signs and symptoms. But in a newborn, that may not always be the case. And so when you have a fever, you do want to take it seriously. We do take it seriously as clinicians to look carefully to make sure that there isn't more going on than just some mild illness, okay? And so if your newborn, especially in the first month of life, has a fever, and a fever is going to be any rectal temperature more than 100.4. So if your baby feels unusually warm, you could do a rectal temperature. That's the most accurate way to determine if they have a fever. And if that temperature is 100, that's not a fever. If they have a 100.2 temperature, that is still not a fever. A 100.4, that is still not a fever rectally. Now, if they do have a temperature of 100.5 and above, that is a fever. And in the newborn, you certainly want to take that seriously and get them to their medical provider for further evaluation. In the meantime, what you can do to bring that temperature down is use some Tylenol or acetaminophen, which would be the generic name, okay? Not ibuprofen, which will be things like Motrin or Advil, because those really you cannot give a baby until they're 6 months old or older than 6 months. All right. So if you have a newborn who is less than 6 months of age and they have a fever, you want to use some Tylenol or acetaminophen to take care of the fever, okay? And you can always look at the dosing on the back of the packaging. It's usually by weight. If they are still quite young, you should reach out to your medical provider to get the accurate dose for your child, okay? Now, Tylenol is one of those medications that you have to be very careful how you dose it and make sure you're using the right dose, because at higher doses, that can be toxic to the liver. And so you want to be really careful when you're giving those Tylenol doses to your infant for a fever. Well, I hope that was helpful. One other thing you can do if they do have a fever is they may not even necessarily need some Tylenol, especially if it's only 100 point something or even just 101, nothing terribly high. You can just put loose, lighter clothing on them. And also, you could do a tepid sponge. So using a washcloth that is soaked in lukewarm water, squeeze that out and then use that to towel them down or to wipe them down. And that can help take care of their fever and bring that down. And again, cannot be overemphasized. If you do have a newborn, especially less than 1 month of age, and they have a fever, you should get them properly evaluated, even if everything else looks fine, because sometimes it is difficult to tell if there's more significant illness going on than just the common cold. All right, well, there you have it for our video for today. I really want to ask a special request of you. If you would let me know if these videos are useful to you. If you're on the email list or you kind of visit my social media pages frequently, you will see that I put out these videos every week. And I would love to hear back from you if you found them useful. If there are other topics you would love for me to cover, feel free to post them in the comments wherever you're watching this, or reply the email that delivers this to you, or send me, PM or DM. I will be more than happy to really entertain all of your thoughts. And this is me wishing you a wonderful week, and come back again next week, and there'll be another video with another topic that hopefully delivers some value to you. Okay? All right. Bye-bye now.